What we're going to cover today, this is about partnerships, about your HeadStart partnerships. It builds on what some of the feedback I gave at the conference about the partnership working and the challenges that you're facing out there. I'm going to be thinking more about what do you need to have in place to drive change across a system as a partnership, and to help structure that I'm going to be thinking about and talking about a model from John Cotter, the 8-step change model. Just to help me reflect on some of the challenges, I'm going to look at the first 4 steps on that model. He concluded, after 40 years of studying organisations, that 70% of all major transformation efforts fail because organisations don't take a consistent approach, or partnerships also not taking a consistent approach to change process, not thinking holistically about themselves and about their own behaviour, and importantly not engaging the workforce effectively. So everybody involved in the change needs to be engaged in that change and understand it. His focus on creating the conditions for change rather than telling you exactly what you must do is appropriate for us to share with you as a support and development contract, and also thinking about it in terms of changing behaviour in the field of resilience. Of course, that also makes it a nice fit. So I'm going to start with increasing urgency and just say a few things about this as a step. Cotter suggests that for change to be successful, at least 75% of the people involved in that change need to buy into it. In other words, you have to work really hard on this first step and spend a lot of time and energy building up that sense of urgency amongst all those who are going to be involved in making it happen. So reflecting on some of the challenges that you face as partnerships in relation to this, you were formed in response to a funding opportunity. You were approached by the big lottery, selected by them, rather than having to bid. For examples, wow, we've got this problem, we really want to go out there, find some money, we urgently need to resolve this is an urgent problem. It wasn't like that. It was like Big found you and said, we think, are you interested? I think some of the helpful things that you might draw on to create that sense of urgency are thinking about the national imperative around children's mental health, for example, and looking at what came out of the Health Select Committee report. Norman Lamb said, children's mental health services, for example, are stuck in the dark ages, not fit for purpose. I mean, really sort of strong words from ministers around children's mental health at the moment, and the need to do more sooner and involve more people in that as well. So going to be some big messages from the current National Task Force around that, which will really add to the urgency to get to grips with this agenda. Cotter would say, what are the dramatic facts? What is it that's really going to win the hearts and minds of people out there, of everybody who needs to get behind this programme and make this change happen across the system? How are you going to reach them emotionally? What kinds of material are you producing, and how are you telling stories that really get them engaged in this and win those hearts and minds? Step 2, building coalitions, partnerships, leading change. You need to bring together that coalition. I think again you've been driven by your funding requirements rather than to get driven together as partnerships rather than coming together collectively. You've got your competing priorities, which cause some problems for all of you. And I've already talked about, and you've got many different voices in the rooms, all shouting about how they see the world. So a lot to manage as a partnership lead, as a strategic lead or a programme manager. But I think it's important. Lots can get lost and missed in that makeup of what's going on in the room. So stopping and reflecting about why should each partner bother to be part of this? Why should they come along to meetings and take part in this? Are they feeling valued? So I'm not suggesting you ask yourself, oh, I wonder if they feel valued. I'm saying ask them. Do you feel valued? Have you been heard in this? Do you feel your contribution has made a difference to how we're doing things and what we're doing? Obviously also competing priorities, massive challenge for you. You're competing for attention, competing for capacity, senior people, time on the agenda, health and wellbeing boards, for example, competing against other priorities. And that rich mix of people that I described, we also observed, there is a way of using that for the good, so inviting that rich discussion and debate between people, but it also needs really well managing with strong leadership so that it is steered and concluded, facilitated, listened to, but concluded into decisive action. I'm going to talk about vision. Anyone who's read even a few lines of any change management document in the world will know that, having the shared vision is essential. So some of the challenges, obviously, concept of resilience is quite complex. I think it's one of those areas, subjects, fields, that it's like the more you know, the less you feel you know sometimes. I've worked around this for many years and I still go, oh, I don't know, I thought I had it. So it is complex in articulating it in everyday clear language. And there are, of course, lots of experts, lots of theory. You've also got Big's own definition to work with, and they've already prescribed this is where you're going with this. So how you make it your own is essential part of the process. And of course there are other strategic visions that you are competing with. So I guess, the question is, and it's a really simple one, it's like the lift question, can you describe the vision of where this program's taking you in a few sentences? You've got to look to the projects and manage the contracts, but it's that projectitis that you've got to guard against. And again, as I always say, the helicoptering out, thinking about what is the vision we're trying to achieve over the long term. And make sure that your change coalition, to use Cotter's language, or your partnership, all the partnerships involved in the HeadStart programme, can describe that in 5 minutes or less, is the test. I think it's important to understand the mood of audience's ears. So a concrete example of this is that young people have said, that we've been involved in with through HeadStarters and in other ways, that the whole notion of building resilience is being translated by some as being about backbone, grit, pull yourself together, pull your socks up type stuff, have a spine. And most worryingly, I've heard some young people involved in HeadStart partnerships using some of that language, and I think it's it's permeating the environment because we're hearing it from government as well. Also important to think about then, are the partners' behaviours consistent with what you're trying to do? And Cotter talks very much about don't just talk the talk, but walk the walk. So again, you might want to think about things like, you're talking about the voluntary sector, for example, and you might be sitting in your partnership saying, oh yes, they have equal voice, yes, they're equally got importance here, we listen equally to them, and they have equal influence. There's something about actually checking that out. Are you behaving in that way? Do they feel that the behaviour, the things you're doing and how you reach decisions is actually mirroring that principle that you're talking about? So just some things to think about there, and again, having that open and honest dialogue with your partners to get the answers. Get them now, don't wait for later when it's time to assess for phase 3. I had prepared just a slide on thinking about CCGs because in thinking about all these things about how you engage, how you get people to see the win-win in scenarios, I think probably the CCGs, the clinical commissioning groups, and the link to the commissioning of children's mental health services and that big pot of money that comes into the system, the biggest pot for CCGs for children's mental health. How does that link in, and how can I get access to some of that. So at the moment, that large circle, that's what they're most interested in, the current state of mental health services, the current pot of funding, that's what they're busy looking after and working around. That's it from us on our very first webinar. I hope you found it useful. Thanks for joining us and take care.